A few years ago, a dog came into my clinic. Beautiful 7-year-old Labrador named Archie. His owner brought him in because he'd been, and I quote, a bit quiet lately. Not limping, not crying, not refusing food, just quiet. When I examined him, Archie had severe spinal arthritis. He'd been in significant pain, probably for months, and he had hidden every single sign of it. Dogs are hardwired to hide pain. I'm Dr. Jason. I'm a veterinarian with over 20 years clinical experience. And in this video, I'm going to walk you through 10 signs that your dog may be in pain right now. Now, sign number 7 is the one that surprises even experienced dog owners. So make sure you stay for that one. Let's start from the beginning. Why dogs hide pain. This will change the way you watch your dog. Dogs are descended from wolves. In the wild, showing pain is dangerous. An animal that shows weakness becomes a target for predators and rivals. So over thousands of years, dogs have evolved to suppress pain signals. That instinct is still completely intact in your pet dog at home. Even though Archie was safe in a loving home, his biology was still telling him, don't show it. That's why by the time a dog is obviously limping or crying, the pain has often been there for a long time already. The signs I'm about to share with you are subtle ones, the early ones. So let's go through all 10. Sign 1, changes in posture. The first sign is one you can spot just watching your dog walk across the room. Watch for a dog that is holding their head lower than usual. A dog with neck or spinal pain will carry their head in a slightly dropped position because it reduces the load on the painful area. A dog with forelimb lameness will lift its head as the painful limb is placed on the ground to take the load off that limb. Watch for a dog that hesitates at the bottom of the stairs, not just struggling, but waiting, looking up, or taking them one at a time when they used to bound up. And watch for a dog that's sitting or lying in unusual positions, turned slightly to one side, keeping one leg extended or shifting their weight when they are standing still. These are all attempts to offload a painful body part. The key word here is change. You know your dog. If something about how they move looks different to you, trust that. Sign 2, reluctance to exercise. This is probably the sign I see misattributed most often. An owner comes in and says, he's just slowing down. I think it's age. And sometimes it is age, but very often it is pain. A dog that used to love their morning walk and now stops after 5 minutes. A dog that used to love fetch and drops the ball after 2 throws. A dog that used to greet you at the door and now stays on their bed. That dog may be telling you that movement hurts. Slowing down is not just getting old. It is always worth having your vet assess it. Sign 3, changes in behaviour and personality. This is the sign that brought Archie to the clinic. He was just a bit quiet. A dog in pain will often withdraw. They sleep more, they seek less interaction. A normally sociable dog becomes reserved. A normally playful dog stops initiating play. But pain can also go the other way. A normally calm dog may become irritable, restless, or even snappy. If your dog has growled or snapped when touched in a particular area, especially if that's a new behaviour, pain is high on my list of explanations. A dog that snaps when you touch them is not being bad. They are communicating the only way they know how. Please don't punish that. Take them to the vet. Now, before I get to sign 4, if you're finding this useful, I've put together a free checklist that covers all of these signs in a format you can print out and keep at home. It's completely free. There's a link in the description below, or if you're watching on a TV, you can scan the QR code on the screen right now to get it to your phone. Right, the next sign is one that surprises people because most owners don't connect it with pain. Sign 4, changes in eating and drinking. Pain suppresses appetite. If your dog is leaving food in their bowl, especially a dog who is normally food motivated, that is a red flag. Now there's also a more specific version of this I see with dental pain. A dog with a painful tooth may still approach the bowl enthusiastically because they're hungry, but then they hesitate, eat slowly, chew on one side or drop food, or avoid chewing hard food like biscuits and preference soft food. So watch how they eat and not just whether they eat. Sign 5, excessive licking at a specific area. Dogs self-soothe by licking. It's instinctive. When something hurts, they lick it. If your dog is repeatedly licking or chewing at a particular spot, a paw, a joint, the base of the tail, and there's no obvious skin problem visible, consider pain as a possible cause. I've seen dogs lick a joint so persistently that the fur disappears and the skin becomes inflamed when the original issue was arthritis underneath. Focused repetitive licking at any single area deserves a vet check. It is rarely just a habit. Changes in breathing. This is one of the signs that surprises people the most. A dog in pain may pant more than usual, even when they haven't been exercising, even in a cool room. Pain activates the nervous system, and panting is one of the body's responses to that. If your dog is panting at rest, at night, or in situations where they normally wouldn't, please don't dismiss it. It is a pain signal until proven otherwise, or a cardiac issue. Either way, they should be assessed by your veterinarian. Sign 7, trembling or shaking. Now this is the sign I mentioned at the start of the video. This is the one that surprises even experienced dog owners. Trembling in dogs gets dismissed a lot. Owners assume it's the cold or anxiety, or it's just something they do. And yes, those things can cause trembling, but pain is also a very significant cause, particularly in dogs with spinal pain, abdominal pain, or pain from injury. The reason it surprises people is that trembling doesn't look like pain, it looks like nervousness. But what's actually happening is the body is bracing against discomfort. The muscles are tensing and releasing involuntarily because the pain signal is constant. If your dog is trembling and you can't clearly attribute it to cold or fear, and especially if it's happening alongside any of the other signs in this list, take it seriously, please. Sign 8, reluctance to be touched. Most dogs love physical contact, so when that changes, pay attention. A dog in pain will often avoid touch near the painful area. They may move away when you reach for them, tense up when you pat a certain part of their body, or look around at your hand when you touch their back. It is a very reliable indicator that the area being touched is uncomfortable. Now here's something practical you can do right now. Run your hands slowly and firmly along your dog's entire back, shoulders, hips and legs once a week. You're looking for flinching, turning to look, muscle tension or a change in breathing when you press on a particular spot. This simple habit has caused serious conditions early in countless dogs. Sign 9, sleep and rest changes. Pain disrupts sleep in dogs, just as in people. A dog in pain may sleep more during the day because activity hurts, but they may also sleep worse at night, shifting position frequently, getting up and lying down again, pacing around the house. You might also notice a dog that used to jump on the sofa and now doesn't, or a dog that sleeps on the hard floor when they always used to choose their bed. They may be finding that getting up from soft surfaces is harder and more painful. Changes in where and how your dog chooses to rest are not random, they are adaptations. Sign 10, vocalization. I've saved this one for last because it is the most obvious sign of pain, and yet even this one gets missed. Whimpering, whining, yelping when touched, grunting when lying down, groaning when getting up. These are all pain vocalizations. Many dogs are stoic enough that they only vocalize when the pain is severe or when it suddenly flares. But here's what often gets missed, the very quiet version. A dog that makes a soft grunt when they lower themselves to the floor, a dog that exhales heavily when they finally get settled, a dog that makes a tiny sound when they try to turn over at night. These quiet sounds are pain They are your dog communicating as gently as they can. Listen for them. I promised you 10 signs, but I want to give you one more because this one is different to all the others. It is your gut feeling. I have been doing this for over 20 years, and the owners who catch things early, the ones who come in before the problem becomes serious, are almost always the ones who say, I just knew something wasn't right. I couldn't tell you what it was, but he just wasn't himself. You live with your dog. You know what normal looks like for them. If something feels off, please don't talk yourself out of it. A vet visit that turns out to be nothing is always better than waiting until something becomes serious. So, what do you do if you've recognised one or more of these signs in your dog? First, don't panic. Most of these conditions that cause these signs are very treatable, especially when caught early. Arthritis, dental disease, soft tissue injuries, these are manageable. Your dog can have an excellent quality of life with the right support. Second, write down what you're seeing before your vet appointment. Note when it started, how often it happens, whether anything makes it better or worse. That information is genuinely useful to your vet, and I can tell you from experience, the owners who come in with notes are the ones whose dogs get the best outcomes because we're not relying on memory in a stressful consult room. Now, I mentioned the free checklist earlier. It's designed for exactly this. You can print it out, go through the signs, note what you're seeing, and take it with you to your vet appointment. The link is in the description, or scan the QR code on the screen now. Third, and this is important, if you see any of these signs, it is urgent, and please take immediate action. Sudden inability to walk or bear weight on a limb, paralysis or dragging of the back legs, severe or unrelenting vocalization from pain, collapse or inability to get up at all. These are emergencies. Go to your vet or an emergency clinic immediately. Don't wait for a regular appointment. For everything else on this list, those are signs to book a routine appointment within the next few days. They're not necessarily emergencies, but they're not things to put off for months either. And please, don't give your dog any human pain medication while you're waiting. Ibuprofen, paracetamol, acetaminophen, aspirin, these can be seriously toxic to your dog. Your vet will prescribe safe, effective pain relief appropriate to your dog specifically. Archie, by the way, the Labrador from the beginning of this video, was put on a pain management program, and within 3 weeks his owner said he seemed like a different dog. More engaged, more himself. He started meeting her at the door again every night. That is what catching pain early can do. If this video has helped you, please consider subscribing. I share vet knowledge that helps you keep your pets healthy and happy for as long as possible. And I've got a video coming soon on how to measure your dog's breathing rate at home if they have heart disease. So subscribe so you don't miss that. And leave a comment below. I read every one. Tell me, has your dog ever shown any of these signs? What turned out to be the cause? Your story might help another dog owner watching this. I'm Dr. Jason from Dr. Pawfection. I'll see you in the next one.